The next segment is courtesy of MedAesthetics Miami, located at the University of Miami Hospital. You can find us online at www.medaestheticsmiami.com or by phone at 305-356-7402. We are also on Facebook, Twitter, and Instagram.
Good afternoon. Welcome everybody to Rosanna's chat. As you may or may not know, we have these discussions with people we think will bring value to the table, who have interesting ideas and are well educated in the topic. These do not represent our opinions, but we find them useful, and we hope that you find them useful as well. They are not advice or intended as such in any way or form. So today we have with us Tom Schelpko. Tom is a DMP who graduated from the University of Miami, and the way we met was very interesting because when I was doing my nursing degree in those times of extreme stress, it was to Tom that I would text at midnight about what was happening, whether I should go to the emergency room or not, because I had a test the next day and I think everything was falling apart. So thank you, Tom. Are you here with us today?
I am. Thank you very much, Rosanna.
Awesome. Well, thank you for being here. And as we both know today, we will be talking about the inflammation on the body and the benefits of an anti-inflammatory diet. Can you please tell us a little bit about yourself and a little bit about your thoughts on inflammation in the body?
As you mentioned, I'm a DMP, a nurse practitioner. I have training as a family nurse practitioner, and additionally I have additional training in integrative medicine and functional medicine and clinical nutrition. So as you mentioned, today we're going to be talking a little bit about how inflammation affects your health and how diet can play a role with inflammation. It does say about 90 million Americans suffer from chronic disease, which accounts for about 75% of the nation's medical care costs. Inflammation is considered one of the pillars of chronic disease. When I say
that
chronic disease, I mean, yes, that's significant. So there's not a chronic disease that you can think of that does not have inflammation as a component. So some of these chronic diseases that we're all very familiar with are heart disease, diabetes, asthma, degenerative diseases, obesity. Yeah, multiple sclerosis as well. That's immunological and inflammatory as well. Even brain diseases such as dementia or Alzheimer's, and even dermatological conditions like psoriasis, atopic dermatitis, or acne have inflammation as a component.
And do you think inflammation is hereditary? Is it lifestyle? What can we do about it?
That's a good question. For a while in medicine, there was this thought and belief system that we would find mostly things related to genetic causes. Well, we now know there's a concept called epigenetics. So it has to do with how the environment, or everything you pretty much interact with, whether your food, exercise, your relationships, stress, even toxins that may come into your body, that they turn on and off gene expression, and therefore that's how disease or health comes about, depending on which genes are turned on at which time in your life.
When does this happen? When does these genes express themselves?
Well, genes are expressing from the time we're an embryo till the time we pass. So those are what affect the aging process. So over time, even people are born with certain epigenetic patterns where they're sometimes born with poor health. And that can be passed on from generation to generation. It's estimated it takes about 3 generations to change epigenetic patterns. So
wow.
But we mostly see some of this, cumulative damage and changes in expression of epigenetics occur as one ages. So as we're all familiar, in your teens and in your 20s, you have a lot of resiliency. You generally have very good health without even trying very hard to have it.
You remember 30s, everything.
Correct.
Right.
Your brain is functioning very well, but cumulative damage as a result of various lifestyle factors, including diet, have their toll and effect over time. So going into diet, the diet that most Americans eat is something called the standard American diet. The mnemonic for that is something called SAD, stands for Standard American Diet. And when it relates to health, when you sum up the American diet, it's sad. So it's sad on many levels. So mostly it's relating, our healthcare system does very good with acute injuries and emergency care, but we are noticing this ever-increasing amount of chronic disease that's occurring in the population. And we probably personally can recognize that there's many family members who have many of those conditions that I mentioned earlier.
Of course.
And they're actually on the increase and on the rise as a percentage of the population.
And why is that?
So part of the understanding is that it relates to our lifestyle factors. One of the key areas is a source of inflammation is the diet we choose, as I mentioned. So what I wanted to talk to you today a little bit about is something called the anti-inflammatory diet. So this is going to be a good way to address any chronic inflammatory disease that you may have that I even mentioned before. Even such a disease that you might not even think of inflammatory, for example, like osteoporosis. You might think that's just a bone disorder, but it's actually an inflammatory disease.
Wow.
Very important, right? So it turns out, and this may, on some level, you'd be surprised, this comes as shocking news to some people, that your diet has something to do with your health. This is not, believe it or not, that seems to make sense, of course, as you say that. But in the medical establishment, that hasn't always been understood that clearly. I can give an example when you take maybe your pet to the veterinarian. Often, I have 3 beagles myself. And when you take them to there and there's a problem with your dog, they're going to ask, what are you feeding your dog? But you go for a complaint to your provider, and it's not that common that they ask you actually what you're feeding yourself.
Well, Tom, this topic particularly resonates with us because in our practice, what we do is we do a lot of lifestyle questions, and we believe in a long-term approach to solution of a lot of the problems, and not just taking a pill to, for a short-term solution.
Correct, and I know that your area of particular interest has to do with dermatology and skin conditions, and we understand that the skin reflects the health on the inside. Really, the basis for foundation of good skin health is the way you treat the inside of your body. If you don't mind, let me just take a few minutes to maybe go over a little bit about the anti-inflammatory diet. So the difference of this, and they break this into sort of the concepts of a pyramid. The anti-inflammatory diet has at its basis, and the largest amount that you should be consuming in a day is vegetables, fruits, whole grains, nuts, seeds, and even leave it water, important that is. So within that area, we're looking at things such as phytonutrients. There's the different colors you get from all the spectrum of the rainbow in the different vegetables that you talk about. We're also talking about healthy fats. We're all probably familiar with omega-3s and how anti-inflammatory they are and how much it's even important that the fat content and the types of fats that you consume in your diet affect your skin health. Even interesting, what's emphasized in these anti-inflammatory diets is things such as green tea, all the anti-cancer benefits of green tea, and all these healthy herbs and spices such as garlic, ginger, turmeric, cinnamon. So we know that these are anti-inflammatory herbs, and they're loaded with phytonutrients that are protective against cancer and other chronic diseases.
Good to know. That's so interesting.
So with all the technicalities, I think some of this can be summarized in a way that can be applied to people's lives. So there's a lot of information that I can go into about the anti-inflammatory diet. Some general tips I just think I'd like to share with you for your audience.
Yes, for sure.
One, when you choose a diet, most important is that you aim for variety in your diet. You need a lot of, as I mentioned, a lot of colors of the spectrum. So you should be looking for foods with reds in them, with oranges and yellows. So we're thinking of maybe we see peppers and we see fruits that come out right. So we're looking for even those greens you mentioned. We're looking for those blues and purple foods that we don't eat a lot of. So those might be some berries that we can think of, blueberries or mulberries or grapes have those colors. That's just in the vegetable spectrum, right? So we're also looking for varieties in maybe some of the whole grains that we eat, because each of these whole grains or beans or nuts or seeds, they each have different nutrient profiles and contents that are essential for our good health. And we're evolved to be eating evolving diets. So remember, it's only within recent history that we've been able to culture foods and eat certain foods nearly every night if we wanted to. But usually certain foods were seasonal. They offer different advantages at different times in our life. Not even just the annual life, but at different times from youth to middle age to old age. My next general tip would be to include as much fresh food as possible into your diet. So moving away from canned foods as a source of food. Some things you may not be able to get fresh all the time, like berries, but sometimes frozen in that case could be a good option. Not as good as fresh, but trying to think of this as fresh vegetables.
You know that I read that when you go to a supermarket, if you stay in the outside, that's where you have to do your buying. Once you go into the inside shelves where everything processes, you have to limit your time there because that's not as valuable.
Correct.
Because of the process.
And you're right. I've seen information on the same thing too, and we can anecdotally relate to our own experience. It's the periphery that tends to have all of the fresh produce. That's where the meat department is. That's where the fruit and vegetable department tends to be on the periphery. And this actually leads into my next point, because in the middle of it is what are most of the processed foods. So the next general tip is to make sure you're minimizing your consumption of processed foods and fast foods. By doing this, you remove many of the foods that we know to be inflammatory. So these are they have the saturated fats in there, the trans fats that may be in there. They're high glycemic, meaning that their carbohydrate level is very high, and they raise your blood sugar. They are inflammatory and meat products that would be in there. So, and they have low amounts of omega-3. So by avoiding the center of the supermarket, as you mentioned, it's one way to minimize your consumption of processed foods and in your diet. Personally, a general policy of that.
Saying that you think that it's a good policy to have that?
That's what I do in my own life. And I really try to minimize things where I have to read many, many ingredients on them. Like if you were to pick up broccoli from the supermarket, I mean, it doesn't come with an ingredient list. It only comes as broccoli.
Exactly.
Right? So you have to be careful then when you buy the frozen broccoli, maybe prepared in a sauce, because then that becomes the problem. Although you may think you're eating broccoli, there's broccoli in there, but it's maybe the cheese sauce and all the components of it, and there's artificial ingredients and the colors and all those things that promote inflammation in your life.
Well, these are great tips, Tom. Do you have anything else that you would like to share with us as our conversation comes to an end?
I think that was mostly it. I think that the other thing just to add in relationship to diet is making sure you're doing it in a setting where you're enjoying meals with other people. Meals are meant to be social. They don't just serve caloric needs. They do, of course, do that. But we have designed spaces as humans to be eating in social areas. So that's why we often enjoy going out with our friends. So we have also found that people, when they're in relaxed environments, they're laughing, they're with their family or their loved ones, that they tend to have good health related with their food as well. So that's just the general setting of the way an anti-inflammatory diet should occur.
Awesome. Well, thank you so much, Tom. These are great tips. Eating healthy and in good company. That's a wonderful tip for us.
Thank you for listening. We are MedAesthetics Miami, located at the University of Miami Hospital. You can reach us online at www.medaestheticsmiami.com or by phone at 305-356-7402. We look forward to hearing from you and sharing our next segment with you.